This conference will now be recorded.
Am I audible? Am I audible?
Yes, sir.
Okay. So today we will be just going through one of the important topics for you as far as your Viva is concerned. But basically, before understanding this topic, instruments, you have to have some idea about different types of surgeries which are performed in ophthalmology. At undergraduate level, you have to know few basic surgeries like small incision cataract surgery, phacoemulsification surgery, and chalazion incision and curettage, dacrocystorhinostomy. So these are few surgeries which you should have witnessed during your undergraduate time. But due to the present prevailing situation, it might not be possible for you to see all these surgeries. So just go to YouTube and watch these surgeries. Small incision cataract surgeries with the intraocular lens implantation and phacoemulsification cataract surgery with intraocular lens implantation, dacrocystorhinostomy, chalazion incision and curettage. So these are some basic surgeries which an undergraduate has to witness or should have a basic idea about. So now, before we go into today's topic is just a revision class or just for you to have an idea about the different types of instruments which are placed in front of you during your Viva VC exams. So these are some of the common instruments, some 40 to 50 instruments are there, which you have to name and tell its indication. So you will be able to name and tell its indication only when you have witnessed the surgeries, which is not possible in the present moment. So I suggest you people to go and watch the YouTube regarding different types of surgeries which are performed. So at least you will have a basic idea of different types of surgeries. So during those surgeries, these are the different types of instruments which are commonly employed. So now first let's go on with each instrument. So this is basically a chalazion clamp. So this is the conjunctival side and this is the skin side. So you clamp, this is the screw here. You open the screw and you clamp the conjunctiva. That is, you push that lid in between these two surfaces, and this open surface is placed in the conjunctival side, and then it is this chalazion incision and curettage is performed. So if you see what is the procedure here, once you place this lid clamp in between the lid is fixed in between these two surfaces. This is the conjunctival surface, and you give an vertical incision. This is a commonly asked question: what type of incision is given? So incision given is vertical. Why? Because vertical you just incise the respective meibomian gland, one or two meibomian glands. But if you give horizontal incision, you cut open all the ducts of various meibomian glands and they become non-functional. So that's why you have to give an vertical incision. So this is a chalazion clamp. So usually asked questions are: what is a chalazion? What is the definition of chalazion? What are the indications of treatment, or what are the various modalities of treatment? All such questions will be asked when you pick up this instrument. Now this is the scoop. Scoop is nothing. Once you give an incision, whatever the caseous material or whatever the purulent material is there, it will scoop the contents out of the chalazion. Now this is nothing but a Tooth's knife. You can see it is a blunt end which is there. It is not very sharp end. This is called as a Tooth's knife. It is used to separate the conjunctiva and the subconjunctival tissue from the sclera and the limbus. It is mainly used in pterygium surgery. The pterygium which has grown onto the cornea, which has progressed over the cornea, to separate out the pterygium from the corneal attachment, you use this type of instrument called Tooke's knife. So a partial thickness scleral flap also, this is another indication of Tooke's knife, where you can prepare a partial thickness scleral flap for trabeculectomy, or during the trabeculectomy surgery in glaucoma. That time you raise a flap, scleral flap, means you raise a small layer of sclera, partial thickness layer of sclera. So that time this knife can be used. The main indication is in pterygium surgery. Now this is superior rectus holding forceps. Its name is Dastu's superior rectus holding forceps. So this is the superior rectus is around 7.7 mm from the limbus superiorly. It is placed the insertion. So you try to hold the insertion with this type of instrument. This you can see that this is the curved shape of the instrument, which follows the curvature of the eyeball. It has toothed edges which will help in holding the superior rectus. So once you hold the superior rectus, you drag the eyeball forward. So that will create a lot of exposed area or the sclera, so that you prepare a conjunctival flap, and then you proceed with the small incision surgery or whichever cataract surgery you want to perform. It just exposes the superior surface of the sclera. Otherwise, normally it is covered by the lid. So this, once you hold the superior rectus, put a suture and then drag that and put also called as fixation forceps. When you are performing the surgery, the eyeball is very mobile, or the eyeball moves whenever you put an instrument, because of your force, because of the force exerted by you. So this instrument will help you fix the eyeball in one particular position, so that you can make an incision, or you can hold the conjunctiva, lift it, tent it up, and make an opening in the conjunctiva. So this is a fixation forceps. It is also called as St. Martin's forceps. It is straight and it has a small tooth here, so that will help in holding the tissue. This is a needle holder. In eye, we use 10-0 nylon sutures commonly. It has a very small needle. So 10-0 means the thickness of the thread also is very, very small. 10-0 or 8-0 we use. It is called as Baraker's needle holder. This is the point where, just like in surgery where we hold the needle with the artery forceps and we put a suture, similarly in the eye we use a Baraker's needle holder, where you hold the needle here and you put a suture to the tissue. Now this is a muzzle hook or a lens expressor. You can see the shape of that. So when you are performing squint surgery, to hook the muzzle, to completely isolate the muzzle from the sclera, this instrument can be used, or it can also be used to express the lens out during cataract surgery. So when you give a pressure from the 6 o'clock position, the lens can be delivered from the posterior, from the back to into the anterior chamber, and then it can be expressed out. Once the lens is delivered out into the anterior chamber, it can be expressed out by putting a pressure at 6 o'clock position, so that the lens is expressed out of the incision which is given in the sclera, or the tunnel which you have made through the sclera or sclerocorneal tunnel. So it can be used in various types of surgeries like squint surgery, enucleation, and retinal detachment surgery. Now limbs forceps. This is also a fixation forceps, like we saw earlier. We saw here St. Martin forceps. This is straight forceps, but this is slightly curved forceps. So it gives an extra advantage in peeling also. Sometimes it can be used to peel the pterygium from the cornea. So used in corneal, holding the cornea and scleral edges. If you want to lift and put a suture, this can help in lifting the flap and applying a suture. Next one is Simcoe's cannula. Simcoe's cannula is nothing but, you can see this is the Simcoe's cannula. There is a pipe here, and this pipe is attached to a empty syringe, and this opening is attached to a irrigation tube from the normal saline or ringer lactate. So there is a continuous flow of fluid into the eye from this port, and this port is mainly used to, or it is attached to an empty syringe which acts as a suction. So you create suction from one port and you create irrigation from one port. So at the same time, what two functions are happening? Irrigation and suction. So there is continuous fluid going into the eye. At the same time, from this side or from this pipe, you are just trying to induce suction by pushing inducing suction in the syringe which is attached to this part of the portion. So for irrigation and suction of the lens matter in extracapsular cataract, aspiration of hyphema in reverse Simcoe ports are reversed. Like say, what is reverse Simcoe? Here you put irrigation port and here you put aspiration port. So the needle has one central port for irrigation and one side port for aspiration. So this needle here which is there, it has two openings, one in the side and one in the center. So through this side there is continuous irrigation occurring, and through the center one there is aspiration which is occurring. So this what is the basic fundamental principle here, why we are using a Simcoe cannula, why you require an irrigation and why you require an aspiration. During cataract surgery, once the lens is expressed out or once the lens is delivered out, there are some cortical matter which are left behind in the back. So when you have to aspirate that cortical matter and clean the bag or clean the capsule, so that time what is required is, you have, while aspirating, the chamber can collapse, anterior chamber can collapse because of suction, and there can be a complication of posterior capsular rupture or PC rent. So to avoid that, what you have to do is, there is a continuous irrigation which is occurring, so that will maintain the chamber. During the maintenance of the chamber, slight suction is applied to aspirate out the cortical matter. So this is a important instrument which is commonly kept in the exams. Now next one is IOL holder. You can see this. This is the IOL holder or IOL holding forceps. IOL holding is nothing but it is mainly used to hold the IOL in between these two openings here. Say this is mainly to place the IOL in the bag. So the gap between the tips are when opposed, in between you place the IOL and you insert the IOL into the eye. So this is an IOL holding forceps. Extension scissors. So during corneal extension scissors are nothing but by the sides. So the corneal extension scissors are nothing but when you want to extend the incision on the either side. Say for example, you're doing a conventional extracapsular cataract extraction, you have given a limbal incision and you want to extend the incision on the sideways. This is the instrument which is commonly used for that. So this there are two types in that, left side and right side. To identify the side, look at the direction of the blade and note the lower blade should be longer than the upper one and should be pointing upwards. So this is the lower blade, this is the upper blade, so this should be pointing upwards. So that will help you identify the side of the extension scissors, corneal extension scissors. This is the BP handle which you must have seen in your first year, where a scalpel blade is placed, scalpel and blade. So this is also used mainly to you place a blade here, 11 number or 15 number blade, and give an incision on the sclera and then proceed with surgery. This is an iris repositor. You can see here, this is an iris repositor. It has flat surface here. This iris repositor is nothing but when the iris is pushed out from the anterior chamber into the onto the sclera, or when the iris starts popping out of the anterior chamber through the incision to reposit the iris back into the anterior chamber, we have to use this type of instrument. So this also can be used to break the synechiae between the pupil and uh, lens during performance of cataract surgery. This is a Decimers retractor. Decimers retractor is mainly to avert the lid. So this is placed on the lid. Like if you want to avert the lid, how we lift the upper lid outwards and upwards like that. Instead of doing it manually, you can use this instrument called as Decimers retractor. It is just like a retractor which you use in many other surgeries, like in OPG and surgery department. We use many types of retractors. So something like that. This is also a retractor which is used to avert the eyelid and see if there is any foreign body or if any problem is there in the upper eyelid fornix. This is an evisceration spatula. You have to know the indications of evisceration. If you pick up this instrument, they will ask you what is the indication for evisceration. So evisceration is one of the common indication. What you have to say is panophthalmia. So evisceration is nothing but splitting of the eyeball pooped out during evisceration. Optic nerve guides. Optic nerve guide is nothing but this is an instrument which is this opening which is there here is used to identify the optic nerve behind the eyeball. This is a spoon-like instrument which is passed along the curvature of the globe and it engages the optic nerve. Once the optic nerve is engaged, okay, what it will do is go and you can go and cut the optic nerve during enucleation surgery. So commonly asked indications of enucleation surgery. What are the indications for enucleation surgery? If they ask, you have to tell glioblastoma, painful blind eye. So these are some of the common indications of enucleation which you have to answer. I think somebody is has switched on his mic. Can you please switch it off? Vijita, roll number 77. I think your mic is switched on. Can you please switch it off? Okay, we'll proceed now. So this is an optic nerve guide, which is mainly used to engage the optic nerve during enucleation procedure. And this is a curved scissor which is commonly used to, once the optic nerve guide engages the optic nerve, this is a scissor which is used to cut the optic nerve in enucleation procedure. This is an iridectomy scissors, or it is also called as De Wecker scissors. During performance of glaucoma surgery, after performing initial steps, we perform a step called iridectomy, where a tissue of iris is cut so that it forms an alternate channel from posterior chamber to the anterior chamber for the aqueous humor to flow into the anterior chamber. So this iridectomy scissors is mainly used to perform iridectomy during glaucoma surgery or during trabeculectomy procedure. What is trabeculectomy procedure? What you make an opening in the trabecular meshwork so that the fluid directly, the aqueous humor directly enters into the subconjunctival space or subconjunctival space instead of following the conventional trabecular meshwork, Schlemm's canal, and so on. It directly you create an alternate passage from the anterior chamber into the subconjunctival space to reduce the intraocular pressure. Whatever the prolapsed formed vitreous also is there, that also can be cut with by using this type of scissors, that is de Wacker's scissor. This is also an example of Stevens needle holder. It's also called, it's mainly used during lid surgeries for passing superior rectus. It can also be used for superior rectus suture. So this is an example of Silcox or Stevens needle holder. So this is like we saw here, this is a Baraka's needle holder. For example, here we saw a needle holder. This is a Barakar's needle holder. This is also a type of needle holder, and now we are coming across this type of needle holder. This is also an example of needle holder. It is called a Stevens needle holder. It is mainly used in lid surgeries or passing superior rectus sutures, like bridle suture can be used for this. Wire vectis. Now this is what is this wire vectis? When the nucleus is delivered out from the anterior chamber, you want to deliver out the nucleus from anterior chamber, and you want to pull it out from the scleral tunnel, and you want to deliver the nucleus out, you have to use this vectis. There are different types like irrigating vectis and so on, wire vectis and so on. Here what is done here is this is placed in the undersurface of the nucleus in the anterior chamber, and then it is delivered out from the anterior chamber by placing a Sinskey hook above. And this, when you place a Sinskey hook above and a vectis below the nucleus, the nucleus is sandwiched between Sinskey's hook and the vectis. So what will happen in after that, this technique is called as sandwich technique, because the nucleus is present in between these two instruments, and you deliver the nucleus out from the anterior chamber through the scleral tunnel. Now, corneal extension scissors, this is mainly used in keratectomy or keratoplasty surgery. It is mainly to prepare corneal buttons. So in usually what are the questions which are asked here when you pick up this instrument? What are the indications for keratoplasty? So you have to tell there are mainly 4 indications like optical, tectonic, cosmetic, and therapeutic. So the optical indications mainly are keratoconus, and tectonic is mainly following mainly for support like desmetocele or corneal perforation, and therapeutic is mainly for non-healing corneal ulcer or fungal corneal ulcer, and cosmetic is mainly to replace a whitish opacity which is present on the cornea, like corneal scarring. So these are some various indications for corneal keratoplasty or a keratoplasty. This is an instrument which is mainly used to make a button of the cornea in keratoplasty. This is another instrument which is commonly used called as Vanna's scissor. Vanna's scissor is nothing but it mainly used for cutting inner scleral flap in trabeculectomy or pupillary sphincterotomy or pupillary membrane or anterior lens capsule. So this is mainly, suppose when you are performing a cataract surgery, if you want to cut the anterior capsule or tag, you can use this instrument. It is just like a scissor, but it is mainly used within the anterior chamber to cut the anterior capsule. Lid clamp. So this is mainly used to perform entropion or ectropion surgeries, where you clamp the lid, means you place the lid on this surface, and you engage the lid on the surface and you perform the surgery. So ectropion and entropion corrections can be performed by using this instrument. So the D-shaped plate is on the conjunctival side. So this is placed inside and this is placed outside, and you perform the surgery by fixing the lid. Otherwise the lid will slip when you are giving incision. So this instrument will help in fixing the lid and aid you in performing the surgery. Ptosis clamp. Now this is an example of ptosis clamp. You can see here. It is mainly used to hold the levator palpebrae superioris during ptosis surgery, so that you can engage the levator palpebrae superioris using this instrument, and then you can excise and resuture it. For example, in levator resection surgery, which is performed for ptosis, you can use this type of instrument. Muller's self-retaining wound retractor. During DCR surgery, when you give an incision on the medial side of the nose or near the medial canthus, medial palpebral ligament, or above the medial, close to the medial palpebral ligament, to retract the incision edges, you can use this instrument so that you can go ahead with the dacrocystorhinostomy surgery. So this is an example of Muller's self-retraining retractor. It is mainly used in dacrocystorhinostomy. Iris holding forceps. Iris holding forceps during iridectomy are nothing but, like we saw, a D. Becker scissor, which is mainly used to cut the iridotomy, are mainly used to do iridectomy. Due to pull the iris out of the anterior chamber, we have to use this type of instrument called as iris holding forceps. So this will mainly help in doing iridectomy. Suture tie. When you are performing cataract surgery, sometimes we might have to put sutures in the sclera. So in that process, we saw two needles which are used. One is one is Barakar's needle. So after taking a bite, if you want to put sutures, it is very difficult to see the sutures through naked eye or through microscope. So you can use this type of instrument to put knots. So there are mainly two types: curved and straight suture ties. Now, how do you differentiate between an IOL holding forceps and a suture tie? It is like this. When you hold the two instruments closer, there is a gap. When there is a gap between, both look similar. When there is a gap between the IOL holding force in the IOL holding forceps, there is a gap here. In the suture tie, there is no gap. So the IOL forceps has a gap, whereas suture tie does not have it. So this is a Wright's needle, mainly used for frontalis sling surgery. Frontalis sling surgery is mainly a surgery which is performed for this one. Congenital ptosis, and there is a very poor levator function. To elevate the levator function, we use various types of slings like fascial latex sling or silicon tube slings. So this is an example of this instrument is mainly used to prepare that are mainly used during that particular type of surgery. Bowman's probe is nothing but mainly used for congenital nasolacrimal tract obstruction. When there is an epiphora or when there is increased watering in a child more than 6 months, whose age is more than 6 months, and all the initial preliminary methods have failed, then you have to proceed with this type of probing, so which will create an opening in the nasolacrimal duct. So this is an example of that instrument that is called as Bowman's probe. So you have to say that it is used in congenital dacrocystitis or congenital nasolacrimal duct obstruction. IOL dialer. Once the IOL is placed in the bag, it has to be placed in position, or it has to be rotated to its right position. So to rotate, this is an hook which is commonly used. This is called as Sinskey hook or IOL dialer. It is mainly used for proper positioning of IOL and the delivery of nucleus using sandwich technique. So during sandwich technique also, as I had said earlier, instrument is mainly used to deliver the nucleus outside. Von Graff's knife. This is if you want to make an incision inside in the trabecular meshwork during glaucoma surgeries. This is an instrument which is used. This is called Von Graff's knives. It is an ab interno corneoscleral incision during cataract surgery and iridectomy operation, 4-dot iridectomy operation, puncture in the pars plana area during lensectomy and vitrectomy operations. This instrument is commonly not kept for in the exams, and it is no longer used nowadays. Universal eye speculum. This is mainly used to retract the eyelids, upper eyelid and lower eyelid, so that you proceed with intraocular surgeries or extraocular surgeries. Now, vitrectomy probes. During surgery, sometimes vitreous comes into the anterior chamber when there is a rupture in the posterior capsule of the lens. So that time you use a vitrectomy probe. So that vitrectomy is nothing but you cut the vitreous which has come into the anterior chamber. So you should not pull the vitreous or you should not meddle with the vitreous because it can lead to retinal detachment. So that is why it has to be neatly cut using a vitrectomy probe. Westcott scissors. Westcott's conjunctival scissors are nothing but when you are performing cataract surgery, you have to remove the conjunctival layer and then expose the sclera. So for that, you make an incision at the limbus level, or you cut the sclera, cut the attachment of conjunctiva onto the sclera at the limbus, and then you expose or you raise a flap of the conjunctiva. So this is called as Westcott's scissors. Settle's bone punch. This is mainly used in dacrocystorhinostomy operation, where you make an opening in the bone, so that you create an alternative passage between the sac and the middle meatus. So in between there is a nasal bone. To cut open the bone, you use this punch called as Settle's punch. So this is a bone gouge which is mainly used to smoothen the irregularly cut edges of the bone in DCR operation. And during DCR operation, if you want to retract the incision edges, you use this instrument called as cat's paw retractor or lacrimal wound retractor, and it is mainly used to retract the lacrimal sac during the DCR surgery. Now, these are the instruments which are of less importance nowadays. This is the Aruga's intracapsular capsule holding forceps. This is no longer used nowadays, this instrument, whereas this is a foldable IOL holding forceps which is commonly used for intraocular lens implantation. And finally, we come to the instrument which is used to make a corneal button. This is called as trephine, or mainly used in keratoplasty surgeries. Here, to prepare a corneal button, you use this type of instrument so that you resize the size of the corneal button based on donor button, which has to be implanted onto the recipient cornea. So this is the instrument which is mainly used in keratoplasty. So basically I hope you have just gone through the instruments and you have heard those names of these instruments. You will not understand these instruments until and unless you see a surgery being performed and how this particular instrument is being used. So what I suggest is in your textbooks there is a chapter called instruments chapter in Khurana or in Parson. Just go to that chapter, go see the names of the instruments and see in which surgery they are performed, and go through those surgeries first in YouTube, how those surgeries are being performed, and then following that you come back and you just try to correlate with this particular type of instrument which is presently being used in this particular whichever type of surgery you are correlating with. So this is usually these instruments will contain 5 marks in your Viva OC exam. So you will have to identify the instrument and you will have to identify one of its use or tell one of its use usually in your Viva OC exams. I'm not able to send this PPT to your class representative because this is a very big file around 100 MB, which is not it is not possible to send it through WhatsApp. So that is why I am suggesting all of you to go through your textbook on the instruments chapter and try to understand the instruments. Whenever you come to your clinics or whenever they are starting, that time you can just come and have a revision of the same so that you get a clear idea of it. Okay. Thank you very much. I shall end the class here.